So today's topic, it's Wednesday, and Wednesday is about stretches. And today's topic is a fun stretch for your back pain and your sciatica. Now, as things that I did and do, and I have favorites, and this is one of my favorites. And we use the foam roll. So if you don't have a foam roll, you're going to need to get a foam roll, but foam rolls are very effective, and maybe we'll have like a contest to win a foam roll. What do you think of that idea? Good idea? I like that idea. Our goal is to give you tools. Our goal is to give you tools so you can live your life without back pain. Because if you have back pain, you don't need it, you can get rid of it. I get a lot of people saying, I want to get rid of it. Well, this is one of the steps that you can do along the path to getting your back better. Doctors are not obligated to report outcomes. Ours are the best. We have a 9-step process. One of the steps is the movement patterns, but also stretching, and this is about the stretch. It's about the hamstring stretch. It's kind of important to know the hamstring. So here's typical spine. Looks like this. Head's here, hips down here. The hip joint is right here, and then the femur comes off the hip joint, which forms the leg. This is the invisible leg, okay? Muscles in the front of the leg are the quads. Muscles in the back of the leg are the hamstrings. Very often when your hamstrings are tight, it'll start to pull your spine back. So if you have a normal curve like this, what happens is the tight hamstrings start to pull your pelvis posterior. And as it pulls the pelvis posterior, it starts to cause back pain. So overactive tight hamstrings are one of the leading causes of back pain. Now, we talked about simple solutions for your back pain. Some aren't simple because if you have a herniated disc, it's not a simple problem to eliminate. And if you have stenosis, it's also not a simple problem. But one of the factors that perpetuates or causes it to continue is the overactive hamstrings. Again, probably one of the most common problems people have is their hamstrings are overactive. So what we want to do is, if it's pulling because it's too tight, we want to bring it back to take pressure off the spine. So what we're going to have you do is we're going to have you foam roll. This is the foam roll. And what you do is you just roll your muscle on the foam roll. I'll show you what that looks like. We have a video of that. Is this in the way? All right. So what are the main causes? Bulging disc, herniated disc, degenerated disc, stenosis. Again, this is a quick fix for a simple back problem, but it's not always a quick fix for these problems, and there aren't quick fixes. We can fix these problems, but you're not going to fix these by just foam rolling. But this is something that, again, you need to do it every single day. Our goal is to get healing in the fascia. Muscles have sleeves around them. We call them fascias. Now, technically, this would be this view here. This is the vertebrae. Okay, this is the transverse process. This is the spinous process. These are the muscles. And the blue area is the fascia. And what happens is the fascia will start to get injured, or it'll get tight. And it's very often from these injuries and the overuse of the muscles that you start to get a sort of a breakdown or a non-healthy environment in the fascia. So what foam rolling does that's so very beneficial is you start to get the blood to flow. You want to get the blood to flow. It starts to maybe break up some of the adhesions in there, break up some of the knots in the muscles, increases flexibility. So what we're talking about today really is about the flexibility of the hamstring. Hamstrings are tight, pull on the pelvis, cause a loading of the disc in your back, perpetuates, means the problem continues. So everything that we tell you is designed to prevent this continuation of the problem. That is our goal. Increase flexibility, increase range of motion, helps straighten out that leg, increase performance. So what do? The hamstring, you're going to divide it into 2 sections, and you're going to roll, and you're going to maybe find a spot that's a little bit sore, and you're going to work that spot, and sometimes you can work it back and forth. Okay? Really important that you breathe. And also, you don't want to do this just when you have pain. You want to kind of do this all the time. Good to increase blood flow, good for flexibility. Today is just about the hamstring, but there are foam roll stretches for every single muscle. And really what we need to do is educate you about the other muscles, because there's a really good one for the quads too. But this is about just the hamstring. But it's gotta breathe, do it every day. So you really need to be consistent and find the areas in the muscle where you're having some trouble. So this is what it looks like. We have Amy, she's a doctor of physical therapy. She's in our Orland Park clinic. Again, this is the foam roll. Now she has a wider foam roll, but for this sake, we're just gonna show what it looks like here. But you're gonna start, you're gonna be in the seated position, and then you're gonna push with your hands to sort of lift yourself up a little bit, and then you'll foam roll on the muscle, and she'll start at her knee and go up to her glutes. So we'll take a look at that. Looks just like this. So put it down underneath you. You're going to start at the knee, and in this case she's doing just the one leg. So you slide it forward and back. If you find an area where the muscle feels tight or it hurts, that's okay. Now you don't want to overdo it, and you don't want to do it for a long period of time the first time you do it, because you will be a little bit sore, and the next day the muscles will be a little bit achy. It's kind of like a massage. After they work out real deep tissue with the massage, it hurts the next day. Same thing. You want to work the muscles back and forth, just like this. Okay? You're going to do it in just for a couple minutes every day. You'll do one side, then you switch to the other side. But the key is just to roll it. And this is the hamstring. You want to do both legs, back and forth, and work out the adhesions. Increases blood flow, work out the adhesions. Most importantly, increases flexibility to the hamstring. You want to increase flexibility to your hamstrings. There are hamstring stretches, but some of the stretches really are a lot of flexion. And we know one of the things you can't do for too long is the flexion. If this does not help you, and you need our help, we solve the problem at the disc. Foam roll isn't necessarily going to solve your problem at your disc. It's going to restore function to the muscles. It's going to increase the blood flow. It's going to give you the flexibility. It's going to elongate the muscle, which is what, we're going to stretch it out a little bit. These are the keys. We have the ability to solve the problem in the disc. If you're not getting better, give us a call. I want you to share this information on Facebook, and I want you to like our Facebook page. Also, what I want you to do is I want you to subscribe to our YouTube page. Follow us on Twitter and follow us on Instagram, and share the information. A lot of people don't know what we do or necessarily how to solve the problem. This is good information that will help them solve the problem. You do these things every day. You're going to walk every day a little bit. You're going to do the stretch in the chair every day a little bit. You can foam roll a little bit. Drink a lot of water. Water is very, 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 very important. So that's it. Not too long today. It's good. Want to make it quick. You guys watch the video, share it, and we'll see you tomorrow. Tomorrow is an exercise. Is that right? Good. All right, so be careful. Be safe. And for YouTube, I'm going to have a video right over here. I want you to click on the video, but also we're going to have a subscribe button on here. If you're not a subscriber, you can push on that button, and you'll get subscribed. That's it. I'm out. Have a good night. Waiting for the cameraman. Turn the camera off.